welcome. Again, good morning, good afternoon, and good evening. Welcome to FP2030's annual measurement webinar, this year entitled Impacts of Family Planning Funding Cuts, Early Insights from FP2030's 2025 report. My name is Althea Wolf. I'm the Senior Associate for Data and Measurement here at FP2030, and our team, along with our close data partners, have an exciting agenda set up. Before we get started with the program, some housekeeping. We do have interpretation enabled for both French and Spanish, since all of our presentation and conversation today will primarily be in English. So please follow the directions here and also the directions that have been posted in each language in the chat just now. The icon at the bottom of the screen for interpretation lets you jump between channels, so I urge you to use it if you need it. This interpretation will also be present in the recordings for the webinar, so the resources that we post after will include these recorded versions as well. So we have, again, an exciting agenda today. I'm joined by various colleagues. So internally, Dr. Semukliso Dube, our Executive Director here at FP2030, Jason Bremner, our Senior Director for Data Measurement and Evidence at FP2030, and Shiza Farid, our Senior Advisor for Data Analytics. We're also joined by our close data partners who you will recognize from these past annual webinars. Adam Wexler at KFF and Emily Sonnevelt at the Track 20 project at Avenir Health. So we'll be hearing from everyone in due time, but for now, I'm going to hand it over to Dr. Samu for some opening remarks. Over to you, Dr. Samu.
Thank you so much, Althea, for this introduction. And first, I just wanted to thank the team that has worked so hard to produce this report. From FP2030, setting up the methodology, the framework, working with the hubs to ensure you collect data on what was really happening on the ground. Really grateful for your efforts in this. And thanking our partners again from KFF and from the Track 20 team from Avenir Health on getting us this far. I think everyone knows. Thank you so much to all of you, civil society represented here, the government representatives here, and also service providers who are seeing the impacts of USAID cuts firsthand. I believe that the report is going to show us that for 2024, that was a zenith year for family planning funding, but 2025 was really an inflection point. My name is Dr. Samu Dube. I'm the Executive Director for FP2030, and I wake up every day hoping that as a community, we all can work hard to ensure that what has happened somehow brings us together to plan differently to ensure that family planning progress that has been made really continues in the next generations to come. Colleagues and partners, between 2020 and 2024, donor governments invested an average of 1.4 billion each year in family planning. And if you look at the data, it was 5 countries that provided nearly 90% of that funding, with the United States alone accounting for 41%. That is huge. But last year, the global funding landscape shifted dramatically. You all know the story. The United States, under a new administration, froze and cancelled most of the global family planning programs and signaled the elimination of future funding. And other major donor governments have announced reductions to international assistance budgets. You are seeing a shift in the geopolitical space. You are seeing a shift on where ODA, that we previously relied on for some of the programs, is going. Let us be clear about what this means, colleagues. Too many officials see family planning only as a line item in the budget. Whilst that is a starting point, we know that this could not be further from the truth. It should not just remain as a line item in the budget. We believe that for many governments, this line item needs to be funded. The money should be not only be allocated, it should be released so that family planning programming at a country level really progresses well. Family planning, as you all know, is really foundational, not only to health systems, but to development and to women's economic participation of building resilient communities. Now, when funding contracts, opportunity will also contract with that. We are going nearer to 2030, as you know. Now, when access shrinks, inequality is going to expand. And as we get there, I know that we will get there with more unequal societies, and that's what we don't want. This is not the moment to retreat, however, which is why I'm proud all of you joining in this webinar today to hear what has happened and what we are going to do about it. It is the moment to reimagine, to mobilize domestic funding, and to engage new partners. I believe we are creative together. We can build more resilient leadership at a country level, and affirming that reproductive choice everywhere is essential to development, to autonomy, and to prosperity. Now, out there, as I'm going to hand over to Jason, let us just all remember the future of family planning cannot just depend on 5 governments. It must be powered by a global movement. I want to appreciate all country programs here represented who have really prioritized family planning, because we need to do more and we need to achieve more even with what we have. And that movement only continues with us. Thank you so much. And Jason, as I hand over to you, thank you so much for preparing this data. I look forward to interactive discussions that are productive and setting us up for success for the future. Thank you.
Thank you, Dr. Dubé. Always a pleasure to have you open up this webinar. And let me just say that in most years, I say it's an incredible privilege to work with all of our data partners to monitor progress in family planning across low and low middle income in our commitment making countries. This year, that privilege has actually been a huge challenge, and I think it's been a huge challenge for all of us. Last year, as Dr. Dubé mentioned, we were reeling from these terminations, from the financial cuts, from the loss of many colleagues' jobs, the loss of programs and termination of programs in many of the countries where we work. And we set forth as the data partners to begin to understand those losses, first at a financial level, and then to think about what those financial losses would translate into in the impacts on family planning programs, and thinking about commodity procurement, about services, and about outcomes. However, this past year has been one in which most of the data collected has been affected as well. And so when we embarked on in 2025 on this measurement and impact report, we knew we would be challenged to capture the impacts. We started with the financial losses. You'll hear about those today. And we began to think about how those financial losses would trickle down into impacts. You will hear about insights today, but I want to start with this main point, which is that more than 80% of donor government funding for family planning has historically come from countries that have announced significant cuts to their international development budgets, or sometimes you'll hear us say ODA. We'll get into the depths of this. We'll hear about which countries and donor governments have seen declines, have announced budget declines and cuts, and we'll start to look at that impact in terms of programs. We'll celebrate the progress that we have seen to date, and then we'll start to think through what comes. Our commitment to you at FP 2030 and amongst our data partners is to be vigilant for the impacts that Dr. Dubé spoke about. And we'll spend the next several years, I hope, both monitoring progress, but also creatively making sure that we are monitoring setbacks. With that, I'm excited to dive into the data, and we will begin this morning with Shiza Farid, my colleague. from FP 2030. So Shiza, I'll turn it over to you.
Thank you, Jason and Samu. Hi, everyone. Thank you for joining us today. My name is Shiza Farid, and I'm the Senior Advisor for Data Analytics here at FP 2030. I'm excited to walk you through our 2025 Impact Report data release, giving you a clear look at our latest data products and the critical trends they cover. But before we dive into the numbers, I do want to offer another important bit of context, which is that the data we're releasing today is retrospective, because all of the surveys and service statistics from health management information systems used in our estimates are from prior to 2025. So they don't yet fully reflect the moment we're all in. Think of the family planning use data I share today as a baseline. It represents what we stand to lose as a community as we navigate the impacts of these funding cuts. And since the data alone can't tell the whole story yet, different sections of the report highlight early insights into the impacts due to the funding cuts. Today, I'll provide global trends on key demographics, modern contraceptive use, and shifts in method mix, and an overview of different sections of the report on how the funding cuts are beginning to reshape family planning programming, including from services or populations impacted. But as Jason mentioned, our primary focus today will be on financing, specifically donor government and domestic expenditure. And for these presentations, I'm joined by Adam and Emily. Next. Many of you join this webinar annually, so you are very familiar with this graphic. It details the process of the 20+ country indicators we annually report on. It's a year-long process, and for the first part of the year, Track 20 works with countries to aggregate and analyze their data. And for the latter half of the year, Track 20 works with FP 2030 to produce and publish this data in an annual measurement report, which this year we're calling the Impact Report. This process is really meant to be bottom-up, starting with countries and ending with the data release. And now getting into what we have released for 2025. Next. All right, this is a long slide, so bear with me. This year, we're releasing a number of data products. The first one is the Impacts Report, which is what this webinar will focus on. So starting with the report, next. We have released a digital version of the report, which is online, and this report is accompanied by a brief which synthesizes the highlights from the full report. Next. We have also released a data dashboard with country-specific data on 87 countries, including all low and lower middle income countries and countries that have made a commitment to FP 2030. The dashboard features country-specific data visualizations for the 20+ annually reported indicators, but it also allows users to review donor finance and domestic expenditure data, the data you'll hear about today. And this section of the dashboard will be updated after the webinar today. It also has adolescents and youth data on both their population size, their family planning use. It allows the user to look at regional comparison of key family planning indicators. So for example, looking at how are regions faring on modern contraceptive prevalence. It also allows the user to look at intra-regional comparison of key family planning indicators. So within a region, how are countries faring on modern contraceptive prevalence? Next. Here's an example of a country-specific data page. This is an example of Benin. And next, I should say that if you're not a visual person, you can also get these tables in very nice Track 20 data briefs. These briefs are available in English, French, and Spanish, and they're available on the Track 20 website and the FP 2030 website. Next. This year, we worked with our Latin America and Caribbean hub, and we released the first ever LAC Data Observatory. They released the first ever LAC Data Observatory, which is meant to be a one-stop shop for family planning data for the LAC region. And this is because many of the countries in the LAC region are higher income and not included in our annual reporting of the 87 countries. Next. Finally, this year, to really understand the impacts beyond just our report, we have also released the Funding Cut Impact Center, which is an online repository aggregating in one place both FP 2030 and partner resources, publications, tools on assessing the impacts due to funding cuts. So other organizations in sexual reproductive health who have tried to look at how the funding cuts are impacting programs or populations and services. These are highlighted in this one place on our website. If you have had a recent publications assessing these impacts, please do share with our team, and we are happy to host it in this place. All right, now getting into the actual data of the report next. So what is the top line data from the report? This graphic provides a 13-year review of the progress made in modern contraceptive use. If you look at 2012 on the left side of the graphic, you see that there were 293 million women using modern contraception, and all the way to the left by 2020, or excuse me, all the way to the right by 2025, this use increased to more than 394 million women. Next. As we've seen from the graphic I just shared, between 2012 and 2025, modern contraceptive use continued to grow, and more women are using a modern method than ever before. To add context, there are now over 1 billion women of reproductive age across the 87 reporting countries, and this population continues to grow along with the demand for services. As of 2025, among this population of women of reproductive age, more than 1 in 3 are using a modern method, which, as I shared previously, is estimated to be around 394 million women, which is an additional 101 million women since 2012. This is a progress that we want to protect going forward, given the new reality. Next. Between this period, there's also been substantial and sustained progress across the countries, including the lowest prevalence countries, and we've seen a shift towards newer modern methods. The number of modern contraceptive users has doubled in 28 countries, and what's even more remarkable is that it's tripled in Chad, Guinea, and Mali. 30 countries have achieved an annual growth rate in modern contraceptive prevalence exceeding 0.5 percentage points, which is very fast. And during this time, we've also witnessed major method shifts. Implants are now the most common method in 13 countries and the second most common method in 17 countries. DRC is the latest country to shift, reporting implants as its most prevalent method. Next. On this slide, I'll preview how this year's narrative is structured. And while I'll give a high-level overview for now, I encourage you all to explore the full details of each section of the digital report. So starting off, as in years past, we continue to track donor government funding. And this year we include this section, and it is a section by KFF, which you'll hear more about today. What's different in this year's report is that we also featured 3 case studies to help us understand early signals of impact due to the recent funding cuts. We have a case study from our FP2030 regional hubs, which captures region-specific impacts. And what you'll read in this section is that there are similar disruptions being faced across regions, but there are also region-specific challenges. The Track 20 case study reviews what we stand to lose without USAID support. This section highlights USAID's vital role in contraceptive procurement, addressing inequities, and health system strengthening. Lastly, we feature data from MSI Reproductive Choices, comparing service delivery before and after USAID closures to identify early signals of the change in volume of service delivery. Next. Today, we're diving into 2 sections of the report, one being the donor government funding and then the domestic expenditure data. And Emily will also highlight information on commodity procurement from her section. Next. Before we hear from Adam and Emily, I want to share some things we're thinking about at FP 2030 in this new reality. We will continue to track and report on impacts of funding cuts, and this year's report is really meant to be initial insights. In the coming years, we'll be reviewing for backsliding in modern contraceptive use gains, any shifts we see in modern method mix, maybe a shift towards less expensive or not preferred options, any slowdowns in the reduction of preventable negative maternal and reproductive outcomes, such as unsafe abortions and maternal mortality, challenges to our ability to monitor the progress given the dependency of a data system that was heavily donor dependent, And then also widening gaps in family planning funding. While we know that the women of reproductive age, this population continues to grow and demand for services continues to increase. So thank you, and I'll turn it over to Jason.
Thank you, Shiza. Great to see these resources available, and for all of you keeping an eye on the chat, many links have been shared where you can access these resources. So with that, we'll dive into the first section of this report that Shiza mentioned, and we'll turn over to Adam Wexler from KFF. Thank you, Adam. Floor is yours.
Great. Thank you so much, Jason. Hello, everyone. Again, my name is Adam Wexler from KFF. I am on the Global and Public Health Policy team, and I am going to be covering findings from our most recent report, which highlights 2024 funding data from donor governments for family planning. And then beyond that, what we can tell about 2025 and beyond. So similar to what Shiza said, this is a backward-looking analysis that really should be considered the baseline or actually a high point because we anticipate significant changes, as you've all experienced and seen, for the forthcoming report on 2025 and beyond. So let's go ahead and look at 2024. Next slide, please. Next slide, please. Okay. In 2024, donor government funding for family planning was about $1.36 billion, which was a decline itself of about 8% or about a little more than $100 million compared to 2023, which was $1.47 billion. Funding in 2024 was one of the lowest levels since the London Summit on Family Planning in 2012, and more than $200 million below the peak level reached in 2019, which was $1.58 billion. The majority of donor government funding was provided bilaterally, about $1.3 billion or 96%. With the remainder, $56 million or 4% was for multilateral contributions to UNFPA's core resources. That's been adjusted for an estimated family planning share. Next slide. So this simply shows the trend over time since the London Summit in 2012 and the date that we started tracking funding. As you can see here, it's fluctuated over the years, but following the London Summit, it increased, followed by declines, and increased again. And then over the past 5 years, it's been relatively steady. There's been some declines, but as Samu said earlier on, about $1.4 billion on average over that 5-year period. Next slide, please. The overall decrease in 2024 was largely due to decreased bilateral funding. Multilateral funding also decreased slightly. Something we saw for the first time in 2024 was that no donor government increased funding. That's the first time it's happened. In every year prior to that, we saw some or several donors increase funding that would compensate for declines or so on and so forth. But this year it was either all declines or flat funding. The US was the largest donor in 2024, accounting for about 43% of total funding, followed by the Netherlands at 14%, the UK at 14%, Sweden at 9%, and Canada at 7%. The US and UK have consistently been the top bilateral donors over the period. When these two are removed, funding from other donor governments has generally risen, but there have been fluctuations. Next slide. This simply shows the breakdown by donor governments. And as Samu said earlier on, the top 5 donor governments, US, Netherlands, UK, Sweden, and Canada, account for more than 80% of total funding. Next slide. And what this shows is it highlights the US, the UK, and then all the other donors. The top dotted line that's green, that's the US funding amount, and it's been flat over the years. The bottom dotted line, that's the UK. It's fluctuated over the period, but has generally been on a lower level the last few years. So the trend over time, really, as you can see by that solid line, is generally an upward trend, but there have been some fluctuations, particularly in the last couple of years. Next slide. Okay, so that was the baseline. As I mentioned before, that should be considered a high watermark. So now what do we know for 2025 and beyond? As you can see here, this is the donors that we highlight in the report. There are 9 donor governments. And of those 9, 6 have announced or proposed reductions in their international assistance budgets. And those donors combined account for more than 80% of family planning funding. So that funding is going to be impacted in some form. Next slide. This is simply that slide that I showed before, highlighting those donors that have announced cuts. Again, those top 5 donor governments accounting for more than 80% have indicated or proposed cuts in 2025 and beyond. So that funding is what we're talking about today. Next slide. Before we get into some of the broader trends that we can anticipate, I wanted to get a little bit more information on the U.S. situation. The U.S. being the largest donor, and with all the changes that have occurred in the past year, it's important to highlight the U.S. process and what we know about what's going on. So first, the U.S. budget process is really complex. Each year, Congress sets the funding levels for the federal government, and they specify amounts by area. So each year, Congress has specified about $600 million for funding for family planning. But then once that happens, it's up to the administration to then obligate that funding, indicating where it's going to go, who's going to be implementing the program, what it's for, and then ultimately spending that money after those services have been provided. The annual global health funding amounts for all global health and family planning, they can be spent over multiple years. So in a year that the U.S. or Congress provided $600 million in 2024, that's going to be spent over several years afterwards. So it first has to be obligated and then dispersed. So you're seeing funding being spent over time. And so while the Congress amount that has been specified has been flat, the obligations and disbursements fluctuate from year to year. And that's traditional across all areas of the U.S. global health budget, and it's something we anticipate. The difference is, of course, 2025. So now let's look at that context in a little bit more detail. As we all know, the administration, when it came into office, froze all foreign assistance funding, eliminated USAID, canceled most awards, and implemented a number of policy restrictions that hinder the disbursement and obligation of not just global health funds, but particularly family planning funds. And then another item that occurred this past year was the administration went to Congress and asked to eliminate $500 million in funding that was already provided by Congress for global health activities. So what they want to do is just eliminate $500 million in funds. Congress approved that, but protected specific areas such as HIV, TB, maternal and child health. There were several areas that were not protected, and that includes family planning, also global health security, and 1 or 2 others. We don't know how much of that funding is going to be taken from family planning, but we anticipate that probably the bulk of it is going to come from that particular activity. So we know that the U.S. funding in 2025 is going to be low compared to prior years, as much as potentially $500 million, but we don't know that for sure. Now, get to this most recent year. Congress recently passed the budget for 2026, where they returned funding to prior year's levels. So again, this year, Congress provided $600 million for family planning and reproductive health. And then lastly, the administration has announced its new America First Global Health Strategy and started entering into country MOUs. These are agreements that establish a plan moving forward where the U.S. will provide funding, usually phasing out over time, and requiring other countries to provide more funding. And they've specified the activities that they want to support and do. And in none of these MOUs that have been made public or even in the strategy itself is family planning mentioned. Next slide. So this slide first shows the appropriation over time. So as you can see, Congress has provided about $600 million each year for more than a decade. That dotted line shows the potential cut that occurred to family planning in 25, depending on where that rescinded money comes from. Next slide. These other lines simply show the obligations and disbursement rates that I mentioned earlier. As you can see, they fluctuate over time. But historically, when Congress provides that funding, it is spent over subsequent years. The question now is that going to happen under the current administration? Next slide. Okay, so again, 2025 and beyond. we're anticipating declines largely due to the US, but also due to the announced ODA cuts from other donor governments that I highlighted before. But then getting back to the US situation, there is a lot of uncertainty. There is available funding. There's funding from prior years that had not been obligated or dispersed. So the question is, will the administration obligate and disperse these prior amounts provided by Congress? And if so, how and on what goods and services and activities? These MOUs that are being signed as we speak, how does family planning fit in the context of these country MOUs? And then finally, funding in 2027 is going to start being discussed in the next few weeks to months. Early next month, we anticipate the administration submitting its proposal to Congress on how much funding they want for these activities. And then Congress will debate the amounts and set a final amount, hopefully later this year. And the question is, will it be maintained at that $600 million level? And how do they ensure that the funding is actually being spent by the administration? So lots of uncertainty, a lot of questions, but what we do know is that 2024 was likely a high water mark. We're going to see declines in 2025, the extent of which we don't know yet. And then the big question is also 2026. Will amounts increase because of the funding that Congress provided this year? And will other donors increase to compensate for some of the declines? We just don't know. With that, I know there'll probably be lots of questions. I look forward to those. But now I'll hand it back to Jason. Thank you so much.
Thanks, Adam, for that sobering outlook. So that gives us a global picture looking at the donor financing. And now I see people in chats wondering what the impact is. So we're going to turn over to Emily Sonnefeld, who will begin to dive into some of the country data. So thanks, Emily, and over to you.
Thanks, Jason. Hello, everybody, and thanks for joining today. For my presentation, I'm going to talk about two different types of data. So the first one is looking at the role of USAID in commodity procurement. The objective is to understand the impact of USAID's closure on commodity security. This information is taken directly from the report. The second type of data is on domestic expenditures for family planning. This type of data is included in the report, but I'm going to focus on some new data and new analyses that we've done since the report was published. And this includes some information on overall data availability and recent trends in government spending. Next slide. So let's get started right away and talk about USAID's role in commodity procurement. Many of you know that USAID was a really important contributor to purchasing commodities in many countries. This includes overall support for commodity procurement, meaning purchasing a lot of different methods, as well as an important role in supporting method diversity and availability. And the role that USAID played in scaling up implant is a really good example of that contribution towards diversity or method choice. Next slide. So there are 15 countries where USAID purchased more than 50% of the most common method for at least one of the last 5 years. So those countries are listed on this slide on the left. And we use the most recent survey for each country to determine the method that is the most used in that country. So you can see, for example, that Afghanistan, which is the country at the top of the list, the pill is the most common method. And just underneath that, for Angola, the most common method is injectables, and so on. All the way down the list, you see Uganda is the last one there, where the most commonly used method is also injectable. So this analysis was done in 2025. So at the time, the 5 most recent years of data were 2020 to 2024. And so those are the years that you see across the top of that table. So anything that's highlighted in yellow is a year in which USAID bought more than 50% of the most commonly used method in that country. So you can see that in 3 countries, and these are outlined on the slide, Haiti, Mozambique, and Rwanda, USAID bought more than 50% of the most common method for all of those years, with the slight exception of that 1 year in Mozambique where they purchased 49%, so just almost 50%. So these 3 countries have the potential to have a really big impact from the loss of USAID. But if we also just look at the most recent year of data, 2024, the last column on the right, we can see that in Benin and DRC, USAID was above that 50% mark in those countries as well. And then in Burundi, Tanzania, and Uganda, those they should be outlined. If you hit next slide, I think they'll show up on there too, those last three countries that I just mentioned, the Burundi, Tanzania, and Uganda. Although they're less than 50%, the USAID still purchased a large percentage of those. So replacing this loss is going to be important for all of those countries. Next slide. And hit it one more time. There we go. Perfect. Okay, great. So I mentioned that USAID played a large part in scaling up implants, and this table helps to illustrate that. So this table is similar to what we just looked at on the previous slide, but it looked at the percentage of implants purchased by USAID over those same 5 years. So this table shows the 16 countries where USAID was the majority source for implants for one or more of the past 5 years. And those, again, those years with greater than 50% are highlighted in yellow. So already you can see how many countries are sort of above that 50% mark. So we see the same three countries, Haiti, Mozambique, and Rwanda, showing heavy reliance on USAID, as we did in the previous years. And you see that reliance across all the years. But if we really focus just on the most recent year, that 2024, you can see that there are 8 countries that have more than 50% of their implants coming from USAID financing. So just as a quick reminder as well, this is only looking at commodities, but we know that there was also a lot of resources put into training of providers to make sure that these commodities were rolled out in support of high quality service provision. Next slide. So the data we just looked at is retrospective, same as what Adam had just talked about, that was from 2020 to 2024. But the extent to which the full loss has already been felt is country specific. So for each country, it depends on how much stock is in the system, if the country had reserves, the length of time the purchase was intended to cover. This is specifically important for implants because purchases often are made to cover more than 1 year of need. And also whether or not a country has been able to secure additional resources for commodities to help cover that loss. So there are many countries where the full impact is yet to be felt. So the data does paint a picture where we see a real risk of decreased method availability or diversity if funding is not found from other sources. Since the report was published, many countries are having difficult conversations. Some are talking about purchasing less of the more expensive methods, like implants. This would have a real impact on availability of long-acting methods. Some countries are deciding to focus their purchasing on that most popular method, thinking that if most women want to and use injectables, then to just make sure that at least that type of method is available. But both of these scenarios, whether you're reducing purchasing the more expensive methods or you're focusing on a single method, the result is the same, and that's less diversity available in the market and less choice for women on the ground. So again, this is really only focusing the look at that USAID's role in commodities. The loss of USAID is felt in many areas, and there's a lot of good analyses that summarize across more areas of investment. And I encourage you to look into that information as well to get a full picture of what it really means around the loss of USAID. Next slide. So now let's move on to domestic expenditures on family planning. This information is collected through family planning spending assessments, which we call FPSA. These are implemented by the Track 20 project, collecting information on how much countries are spending from their domestic resources. The FP2030 report also includes data from WHO national health accounts, but I'm going to focus on FPSA for this discussion. An important caveat about expenditure data is that it is always at least 1 year behind and sometimes 2 years behind. So for the current round that we're talking about, which the current round of data collection for expenditure information, which started in 2025, we're collecting data from 2023 and 2024. So again, very much within that framework that Shiza started this conversation off with about a retrospective look at spending and trying to understand what our baseline is in the new reality of the closure of USAID, as well as the reduction in other funding that was just talked about by Adam. Next slide. So we have data from the FPSA for 4 years, starting in 2021. So this table shows the number of countries included in each round. You can see that 2021 and 2022 included a lot of countries, 50 and 46 respectively. We did not have funding to collect the 2023 data, so we skipped a year. However, in the current round, we're trying to collect data for both 2023 and 2024 at the same time, trying to make up for that lost round. So the reason that the number of countries for 2023 and 2024 are much smaller are for two reasons. The first is, as a project, our funding has decreased, and we now only have resources to collect data for 26 countries. So we're not going to get close to that 50 or 46 right now. The maximum that we're going to have is 26 countries. But secondly, this last round is a work still in progress. So you can see on the right side that there are 8 countries that have not yet finalized their data for release. So the numbers in the table for 2023 and 2024 will increase as we receive more data. So that work is still progressing. So since the full set of country data is not available, we can't do a complete analysis, but we can still get some helpful information from what we're seeing as the data comes in. Next slide. Total expenditures are available for each year. So we need these total expenditures to calculate spending across the FP 2030 countries. So this is the data that we get to combine with what Adam just showed so that we can better understand both international as well as domestic funding as a whole. However, since the list of countries is not exactly the same each year, comparing year to year is challenging. It's easier just to look at each year individually in terms of which countries are spending the most and which countries are spending the least. So as an example from the table here, you can see in this slide that the Philippines and Bangladesh have the highest expenditures in 2021, 2022, and 2023, but we don't have their data yet for 2024. So if we were to say who's spending the most in 2024, it's going to come from this smaller list of countries that isn't quite yet complete. So we did include among the more recent data from 2023 and 2024, the data from all of the countries that we have so far listed in order from highest to lowest spending. So we can still get an idea of the variation. It's just from a smaller group of countries. So if we just look at 2024, you can see as of now, from what we have, Cote d'Ivoire is at the top of that list, likely to change as some bigger countries come in, but that's where we stand now. And Madagascar is at the bottom of that list. Also, again, likely to change as we get some data from some smaller countries. But looking at the data in this format isn't always helpful. The Philippines and Bangladesh have large populations, so we would expect them to spend more than smaller countries like Djibouti or Sao Tome and Principe. So it could be more helpful to look at the data per capita using women of reproductive age. Next slide. So this slide does that. So it looks at spending, how much a country is spending per woman of reproductive age. So what we see here is that the highest and the lowest spenders in those first 2 years of data, 2021 and 2022, they change, except for the Philippines, which is still among the highest in 2022, meaning that they have comparatively high spending both overall and per woman of reproductive age. But the other countries on the high end are now different. So if we focus on the newest data in 2023 and 2024, what we can see is that Zimbabwe is at the top of the list in both countries and actually has an increase between the 2 years, right? So this gives us a better understanding about how much is being spent in relation to the size of their population of women of reproductive age. But there's a pretty big range. So just looking at that final year, Zimbabwe is almost $12 per woman, and as a high, and then the low is about 30 cents per woman that we see spending in Madagascar. So again, this list will get increased as more data comes in, and we'll see if that range changes and how countries move around based on the new data. Next slide. So as of right now, we have 11 countries where we have data for all 4 years, right? So we have data for 2021 through 2024. So this graphic allows us to actually look at year-on-year changes for this small subset of countries, and it shows the total expenditures for each of those countries. So what you immediately see here when you look at this graph is that there have been large increases in Cote d'Ivoire, Zimbabwe, and Kyrgyzstan. In Cote d'Ivoire, which is that light blue line at the top, the increase happened between 2022 and 2023. In Zimbabwe, the dark blue line at the top, the second one down, the next blue line there, and in Kyrgyzstan, which is a lighter purple, sort of at the top of the clump of countries down there at the bottom, There were increases between 2022 and 2023 and 2023 and 2024, so increases both in the last 2 years of data. And then sort of buried in that little group, it's the second country listed from the bottom. What you can see is there was actually also a decent increase in Niger in the last year of data between 2023 and 2024. But changes in the other countries were actually a bit minimal. If we go to the next slide, we can take a bit of a deeper look at what those changes actually look like in Cote d'Ivoire and Zimbabwe to see if we can understand where some of that spending is actually changing. So on the left, we have Cote d'Ivoire, and you can see that most of the change occurred in that bottom color, that sort of turquoise color at the bottom, which is personnel costs. And okay, indeed, in 2023, there was a raise for civil servants and also removal of a stop hiring order. So they were able to increase pay, but also have some hires to fill some empty positions. And you can see that really reflected here. You can also see an increase in operational expenses, which is that purple towards the top, and then an increase in capital costs, which is that light blue at the top. But that really happened just in 2023, where that cost goes down to not very much in 2024. So they had some capital investments in 2023 that sort of continued a little bit into 2024, but was really isolated in that 1 year. But if we look at Zimbabwe on the right, the situation is actually a bit different. So you see that in 2023 and 2024, there was an increase in spending on logistics and transportation. That's the light blue. You see that for policy development and advocacy, which is that light green, there was also increase in those two final years. And that there was an increase in program management, which is sort of that medium blue towards the top. And those are all sort of categories that we didn't see in the previous years in 2021 and 2022. So both countries saw increases in expenditures, but not in the same categories. Next slide. So this next slide, this slide here, it looks at the aggregate of expenditures for those 11 countries. So adds them all together. And this just helps us get an idea of what we're seeing in terms of major areas driving total expenditures. And personnel is consistently the largest category. This is the one at the bottom. This really isn't surprising since countries are supporting provider salaries, right? They're paying the workforce that's providing services. But what we do see, and which is nice to see when looking at the 11 countries over time, is that expenditures are actually increasing. And we can see that here. Domestic government expenditures are increasing. Next slide. So just as we did before, sometimes it's helpful to look at the expenditures per woman of reproductive age. This helps us mitigate that difference between large and small countries. So this slide is helping us do that. So as you can see, most countries are increasing their per women WRA spending. The lines are going up, although not all at the same rate, but tends to be a positive relationship here. So we have seen large increases in Zimbabwe, Kyrgyzstan, Congo, and Cote d'Ivoire, although Cote d'Ivoire's large increase stops in 2023. 2024 is sort of flatlined. But then there's also large increases in Benin. And again, in that final year in Niger, we can see an uptick in spending. There were modest increases in Bolivia and Sri Lanka, and then minimal change in Mali, Vietnam, and Madagascar. So we're also working to collect some qualitative information in some of these countries to help us understand the decisions that are driving some of these changes. We're not going to be able to get that in all countries, but we're hoping to focus on some of the countries with the biggest changes so that we can see if they're linked to policies, if they're linked to partners, if they're linked to different government priorities, for us to really understand sort of how do we get in the details to understand what decisions are actually influencing these changes in expenditures. So it's a small subset where we have data for all 4 years, but for that small subset, the trend looks pretty good. Next slide. So this expenditure data has a lot to offer. Looking at the total family planning expenditures from governments, as well as sorting into specific spending categories, is going to help us understand what government is prioritizing. However, getting this data is not always easy. In most countries, the family planning program is part of a larger health program like maternal health, so they don't have their own budget and their expenditures are mixed in with those of other health programs. So it does take time for consultants to figure out how and where to find and access this data. And then before the data becomes public, governments need to validate the data and give permission for public dissemination. And that's an important thing to understand, is that anything that we're looking at has been given permission by governments for public release. But this process is getting easier each year as both the consultants and the governments become familiar with the methodology and the process. And lastly, just a reminder again that this data is always at least a year delayed. We're tracking spending, not budgeting. So the full year has to pass to count all of the expenditures that happen. And more of this data will become available on the FP 2030 and Track 20 websites. And I encourage you to dive in and explore and see what you can figure out with the data yourselves. So thank you very much. And back to you, Jason.
Great. Thank you, Emily, for that tour de force and looking at early insights on impact and what we're learning. Also retrospectively by looking at trends on domestic expenditures. So I am going to do my best to organize our panelists, our questions, all of the insights from all of you in the chat as well. So let's just keep this free flowing. I don't want to just see myself there. So if my panelists, Shiza, Adam, and Emily can join me with your videos on, that would be great. Thank you, Adam. And if you could remove this spotlight from me so I'm not the only one here, that would be helpful. Thanks. All right, so lots of great questions coming in, and we're going to do, we'll kind of do some easy ones to warm you guys up and then get to some harder ones as we go. And we do have, folks, we have more than 30 minutes for these questions, so please feel free to keep this going. And if you are active in the chat and see something that you also want to reflect on and answer, I know there are people in the audience here and participants who can probably answer some of these as well. And I see John Stover doing that. Thank you, John. So first, we'll start an easy one. Emily, somebody asked about information on Egypt. You mentioned that data over time has fluctuated on these family planning spending assessments. Somebody was asking specifically about Egypt. That's an easy one for you to answer.
Maybe. So definitely not included in this round. No, sorry, we're not going to have any new information from Egypt, at least not with the current resources that we have. Sorry for that.
Thanks. And there are some, I think, in the previous year's data. So if they do look back several years, we do have some family planning spending assessment. But this is, I think this is the reality of the data picture at the moment. So data, financial losses haven't just impacted services, as we're talking about, they are also impacting data systems. And when we talk about, I think that Samu mentioned the zenith of financing for family planning, the declines have also affected data availability. And we're seeing that in the family planning spending assessments, where over time we're seeing fewer of these available across a lot of the important countries. All right, Adam, there's some additional questions just for you on what you could say about other ODA cuts since this report was released. I know the report, I believe, tables say one thing. I think you had updated some of your slides, but I think last year, even when we went to the International Family Planning Conference, we were still just absorbing some of these ODA cuts, and some have come in since. Is that right?
That's correct. At the time that the report was released, we had highlighted 5 donors in particular that had announced ODA cuts. But since the report was released, Canada has announced cuts moving forward, focusing on 2026 and beyond. So yeah, it's an evolving landscape. To what extent family planning is going to be impacted is one of the key questions. We have within the US where it was very specifically targeted by the administration, but then Congress has pushed back, so there's questions there. But then in some of these other countries, these are broad cuts, and the specific areas that are going to get impacted are not fully known. So that's something that we're going to be tracking. Obviously, this next report is going to be very important to assess where the donors stand, and then also beyond because of the more recent announcements.
So maybe just following up on that statement, I think there's another question floating around here about the graphic you showed with a rescission where this 500 million that had been appropriated was rescinded. You are showing that it's likely in 2025 we will see, a lot less spending by the U.S. government on family planning. You noted appropriations for 2026, so that's really data to be, or that's money to be spent, are appropriated now. So theoretically, they are available. In the past, how was that appropriated money spent? Like, what were the mechanisms that those were spent by? And do those mechanisms exist today? And therefore, are there actual means to spend this money that Congress has appropriated?
That's the big question. But to kind of step back a bit and to kind of go over the process that you're mentioning, as I said before, Congress gives a set amount of money for a range of global health activities, on average 600 million a year for family planning. Once that occurs, the administration that's in office then takes that money and plans with it. They enter into contracts, agreements, and then they obligate the funds, say, this money is going to be spent for this activity in this country with this implementing partner, so on and so forth. And then after that, money is dispersed. So funding that Congress provides in 2026, it is not going to get out the door right away. It takes some time to go through all these mechanisms and processes. And so what you see happening is that funding provided in one fiscal year will take several years to fully be dispersed or hit the ground, shall we say. The problem now is, as we are all aware, with the elimination of USAID and the canceling of contracts, there are no mechanisms or people or personnel in place to then start doing this work. Now, the administration has obligated funds and has dispersed funds over the past year, but it's been at a much lower rate than in prior years. And it's still, the data is still becoming available on to what extent disbursements were made throughout all of 2025 and obligations. So what remains is a big question, and we're doing everything we can to analyze that. And as more information becomes available, we'll be releasing what we know, and we'll be highlighting that in the next report. But to your beginning question, there's a lot of uncertainty. There's a lot of money that's still available in the coffers for a range of global health activities, but particularly family planning. The question is now, how is it going to be spent? What are those mechanisms? Is it going to be through these MOUs? There's no mention of it in those agreements that have been released, or is it through some other approach or mechanism? And that's the big question.
Thanks. And my understanding is that almost all of that spending was done by USAID, and with the dismantling and dissolution of USAID, essentially, those implementing mechanisms just don't exist in the same fashion. So thanks for that.
Yes.
All right. So obviously all of this has implications for countries, and I see a healthy conversation going on in the chat regarding domestic spending. And perhaps, Emily, just sort of a general question on the domestic spending. There's a question just to better understand how the domestic family planning spending is estimated. And there's like larger maternal health and reproductive health budgets. And you just say about like the family planning spending assessment, how does it work? What is it like? What is it that you're capturing? Do you start from like a big budget and then trying to break down the components, or are you starting from the bottom up in terms of this analysis?
Yeah, okay. I'll give that a shot. Although there's certainly John and Rudolph who are online responding to the questions in the chat are really the experts that are kind of driving that. But before I do that, I want to mention, and I should have mentioned this in my presentation, that the information that was presented around the USAID commodities, that data comes from RHVIZ, which is put out by RHSC, the Reproductive Health Supplies Coalition, and that is publicly available data. So if there are any countries that weren't included in the analysis or anything that you want to explore, I encourage you to look at that. It's a really rich database that has a lot of information. So apologies for not saying that during the presentation. Okay, back to FPSA. So FPSA is definitely a bottom-up approach. So we're looking at expenditures, not budgeting, which is why it takes a bit more time and a lot of effort. And the process that it's used are consultants in each country so that they can actually go into family planning offices, have conversations, look at the documentation that's there, but also try to make sure that we're not missing anything that's kind of going out and sort of being used at the lower level. There is a challenge between collecting information at the national level versus countries that do a lot of allocation and spending expenditures at the decentralized level. And that's a challenge that I think is still being dealt with. And we're trying to figure out in each country, how can we collect more of those expenditures that are being managed at lower levels? And the extent to which that's captured is going to vary by country. So I think that's a really important distinction. Um, in terms of the categories, we try to get as much information that we can on direct spending, meaning this is amount that was spent by a family planning program to do a training in Nigeria. That's the information that we want. But for some of the other information, like capital costs, or some of the information around infrastructure, that's actually organized by allocating total costs to family planning using the percentage of all health visits that are family planning visits. So in that case, it's easy to disaggregate from maternal health. So we know how many services are being provided for family planning that are separate than maternal health services. So when we do the allocation, you can sort of isolate the contribution that we think that should go specifically to family planning. Um, that there's also some methodology that we use to try to estimate the amount of time providers spend on family planning services based on the services that are being offered in that country. And so again, those should be able to be separated from maternal health. Um, Based on assumptions, the method mix and the number of users in the country, but trying our best to get as close. Where we really have some challenge is trying to get sort of IEC expenses, provider expenses, and supervision expenses that are specifically related to the family planning program. And that's where some of those qualitative discussions come in, is for us to understand how do you do that? And it's different in each country. So it depends on which part of the data you're looking at, how close we're getting to direct family planning spending versus how much is being distributed by the algorithm, like for capital costs. But we're trying to make the documentation for each of these countries better. So that's a bit clear as you start to dive into the data. And if I said anything wrong, Rudolph and John can correct me in the notes. So please be on the lookout for that. So thanks.
Thanks. And I do see John and Priya active in the chat as well. So I won't say they're correcting you, but they are filling in additional detail. And so you had talked about commodities in particular and using RHVIZ to show commodity dependence on USAID in particular. So where USAID financing that Adam said is now lost was focused on particular methods and what that might mean in countries. So what's our timeline for understanding or getting visibility into service declines? It's one thing to say, hey, we have historically been dependent in X country for implants. And I suppose we could, through RHVIZ and the great work of RHSC and UNFPA, GFF, and country governments that are putting that procurement data in there, we could start to see changes, fluctuations in procurement of methods. But that doesn't tell us what women are using. I mean, an implant lasts several years. And so what are we going to do to understand the impact on changes in services and then ultimately outcomes for women, changes in method mix, discontinuation, or if you discontinue because you want to have a pregnancy, but then you go back to start on your method and it's not there anymore. How are we going to be creative? I know Track 20 is thinking about this.
We are, and it's kind of it's a really complicated question because, one of the things, if you think back to some of the data analysis that was done during COVID, where there was originally an expectation to have a lot of really quick impacts on family planning programs, and what we found is that quick impacts didn't necessarily show up in most places. Some places, sure, but a lot of that has to do with method mix. Right. So, Jason, as you just said, in countries that have a lot of implant use, that use is going to continue for a little bit. Right. So in those countries, it might be a couple years before we see a big impact if those implants aren't available to be replaced. Right. Or if there aren't methods for women to switch to at that time. So how quick we see an impact in these countries is going to really, really vary. And then in addition to that, just to throw something slightly more complicated, USAID was a really, really big supporter of country systems, including data systems. So they put a lot of money into LMIS, and in some countries, they put a lot of money into HMIS. And so the sources that we're going to need to use to understand those dynamics on the ground are also impacted by declines in funding. And so we're going to have some challenges on that side too. Countries are dealing with that, trying to figure out how to make sure that those systems continue and are reliable. The biggest immediate impact was on LMIS, and countries have sort of rebounded to try to figure out how that data source going. But in reality, those are the only sources that we're going to be able to use to be able to start to understand when the real impacts start to hit. And so we are working with countries to look at the number of clients that facilities are seeing and that, government is providing services to. And in some countries, we're already starting to see a little bit of a stall. And a little bit of a sort of it's not a decline yet because we got to get to a stall first before we start to see those numbers going down. But it is something that is being actively tracked by countries and will need to be actively tracked. But importantly, we need to make sure that the data is available and that the quality is good enough for us to actually use it when it's available. But that's where we have to look. We have to look to the country data. It's going to be the first smoke in the caveman or whatever it's called, the first signaling.
I think we call that a canary in a coal mine.
Okay, there you go. I'm like, the first
Thanks.
signals that start to come out is going to come from that data.
Thanks for those insights. And I'll just say a word about another section of the report that's not presented here today, and that is thinking about the role of the private sector. If the public sector isn't able to procure, will people shift, go looking in other places? Will the private sector pick up some of the of that decline? And in this report, we have, as Shiza mentioned earlier on, we have MSI, who was looking at their own service statistics this past year. And so we will continue as, I would say, as a community to look not just at the public sector, but look at the private sector and try to get these signals of impact across both like procurement, HMIS through services in the public sector, and where we can at the private sector. So thanks, Emily, for those insights. Adam, relatively simple question for you on USG funds and whether the 500 to 600 million included funds that go to UNFPA. And maybe you can expand not just on the USG funds, but how do you handle the UNFPA funds? I know it's detailed in the report, but if you could just say a word here.
Sure, of course, happy to. So donors provide funding to UNFPA in two ways, to core resources and non-core resources. So core resources are just the general budget that UNFPA has to implement programs and activities, and donors give that usually on an annual basis. Then the non-core resources are more specified funds, where UNFPA would be more of like an implementer. So in the case of the US, for our donor tracking, any non-core resources that are specified for family planning is captured as a bilateral contribution because UNFPA is implementing that donor government's activity at the donor government specified focus area. And if it's family planning, we include that as a bilateral in the bilateral totals. The core resources, we work with UNFPA to do an FP adjusted share. So how much do they spend on a given year for family planning? And then we apply that percentage to the donor government's core contribution. Now, for the US, it gets a little more complicated as always. And there is this particular policy provision in annual appropriations that gives whoever's in office at the time the ability to stop funding UNFPA. And basically, what happens is this is the Kemp-Casten Amendment, and basically we have an explainer which we can share later. But Republican administrations, when they come into office, they stop funding UNFPA, both the core and non-core. And then when Democratic administrations come in, they start funding it again. But there is a specific line in appropriations that if funding that Congress says needs to go to UNFPA does not go, it needs to go back to bilateral programs for family planning and maternal and child health. So basically, that $600 million amount includes the core contribution that the U.S. provides, as well as any kind of where the UNFPA is the implementer. And in those years when the Republican administration is in office and doesn't give that funding, it ends up going back into the family planning bilateral pool of funds to be dispersed. So I know that's complicated, but if there are more questions, please let me know for clarifications. Happy to share more.
So then as a follow-up to that, you are tracking the amount that the donor governments are giving to UNFPA and capturing that in these amounts. But you are also asking UNFPA about their families planning spend each year and tracking trends in UNFPA spending on family planning. I know you've been doing that for many years now, and can you say anything general about the family planning spend by UNFPA? Has it been increasing over time, decreasing over time, relatively stable? And is there anything that we can say sort of moving forward about UNFPA?
Well, what I can say is it does fluctuate from year to year on how much. So the percentages can be, several points different, which has an overall impact in how much is being considered from a donor government's pool that's going. And the reasons for that I can't speak to. Some of the reasons for the fluctuations that we see in donor government funding is just the nuances of when money gets out the door. So it could be a function of that. That being said, moving forward, it's unclear again. We don't know if donors are going to provide more to kind of support UNFPA when the U.S. funding was eliminated by the current administration. That did happen in the first Trump administration. Donors stepped up. Whether or not that happens, we don't know yet. We'll be tracking it and highlighting that in our next analysis.
Yeah, I think that's a really important point, which is the last time that USAID stopped funding UNFPA, other donor governments actually announced increases.
That's right.
And it's an important point you made that this was the first year we saw no donor government announce an increase in their or show an increase in their disbursements. So that's a first, and it's again a warning sign, I think, to this community that perhaps those resources just aren't there across the community to fill in where there have been gaps in U.S. appropriations.
Yes, and I'm sorry, just to follow up on that, and that was prior to 25. I mean, we're talking that's 2024 when that happened, and so that's why the assessment of 2025 is going to be very important. And will be an indicator of where things were in the past year, and will probably, hopefully, informed what donors will do in 2026. So we'll be working on that as we speak, and we'll be prepared to share those findings as soon as possible.
Great, thank you. All right, I'm going to turn to something that's should be really easy for you, Emily. We're going to turn away from FPSAs and talk about family planning data. There was a question about the demographic health surveys. So last year, around this time, um, we were reeling in the data community from the announcement of the termination of the demographic health survey program. And so there's been this question about what's happening with the surveys. And I know you can say a word about recent release of surveys, those that were sort of being completed. And then we had earlier folks from Demographic Health Survey program in the participant list, and those folks could add in the chat anything further on DHS program moving forward. But are we still getting data from DHS, recent releases from countries, and what do you know, and how do you think we'll rely on the DHS moving forward as we try to track impacts?
So, there was an investment by the Gates Foundation to finish off some of the DHS surveys that were either almost finished or already fielded when USAID closed, which is really helpful because there was a lot of data that a lot of resources had already gone into that was able to sort of still not be lost. And so we have had some new releases of DHS since the closure of USAID. And for example, both Nigeria and DRC have data, and that's helpful. These are big countries, and it's helpful to understand their family planning programs. However, for the annual estimates this year, it's actually still data that was collected in the before times. So that data provides more information for us to understand what our baseline really was. But really, we don't have any survey because of the delay, the length of time it takes to process the data, to do the analysis, to publish it, to get it validated, approved, and then released. Data from surveys has always been retrospective by at least a year. And so that situation continues. So we are getting new data. It's incredibly helpful for countries to be able to have the data available to help them understand how their programs are doing well or not. But as of yet, even the new data that's available isn't really going to help us understand the impact of all the funding changes in 2025. So that's something that we're going to continue, that we're going to struggle with this year to figure out what data do we have to really understand, can we capture any changes that happened last year, and how does that look in different countries? And it's something that we're starting to talk about. With that said, there is some information that there's going to be some new surveys that are being fielded now. There's new data being collected, and that will be really our first indication of detailed information, right, from women themselves, letting us know what is happening on the ground after the changes in this funding environment. But we're not going to get that for a while. So if they're collecting the data now, we probably aren't going to get it next year, maybe early 2028. So that lack of time is sort of where we sit now. That we have a lot of information now about before, soon, but in a couple of years, we're going to have a lot of information about now. But trying to figure out how we navigate that in between time to not only give us as a global community understanding to what the impacts are and what's happening, but give countries the information that they need to be able to monitor their own programs and sort of determine whether or not the decisions that they're making, especially now that there's big trade-offs because of lesser funding, what's the impact of those trade-offs? So figuring out how to do that, I think, is going to be really important. So I'm grateful that we're getting those surveys from those countries that are still coming out, and that money and that time wasn't lost. And I'm grateful that we're going to get more. But I'm still in that in-between time, I think, trying to figure out what to do then. I know that kind of talked a little bit about DHS, but also spun around, Jason.
Well, I mean, I think it's
but
important.
Just trying to figure
Yeah.
out, how do we know what happened last year, which is the question that we really all have to answer.
Right. And that's where we'll have to be creative using things like HMIS, LMIS. Colleagues from our HSC are here, and they'll be looking very clearly at, I would say, I'm not going to call it real time, but much more real time data on procurements and in the global van. So that's a call out. And if folks from our HSC want to put something in the chat about how they're doing that. I mean, I know that that's the sort of real time that we don't capture through a demographic health survey or through a family planning spending assessment.
Yeah,
Or
and
through a KFF analysis. But it doesn't mean that those long-term data tools aren't still critical. They become sort of these benchmark baselining moments. People often ask me, can we measure contraceptive prevalence, Emily, from HMIS data or from a program that's seeing impacts like MSI? I mean, I know the answer, but can we do that?
Yeah, the answer is no. And so, those of us who work in the space of doing analysis and creating new indicators and even creating, methodology to do modeled annual estimates, the inputs into all of those tools are surveys.
Yeah.
Right. So for us, for the methodology for FP 2030, we're combining surveys and service statistics to be able to try to make sure that we're getting the more reliable data from surveys, but then understanding what the trends are telling us from the most recent data you can have, which are service statistics. So surveys are important for a lot of reasons. All of us rely on them in the data community to be able to validate our findings, right? We can make a lot of assumptions about what's an analysis to understand what we think is happening in 2025, but eventually we're going to need surveys to be able to tell us how right we were. But also, and I think this is a distinction that we sometimes forget, is HMIS and LMIS are system data. This is information about services provided. It's information about commodities dispensed. It's information around, how things are happening within a health system. They're not information that is coming directly from women. They're not asking women what their experiences were with the health system. They're not asking women if they got the method that they wanted. They're not asking women if they want to use family planning or if they want to get pregnant. So they're two very different sides of data that are complementary, and you need both to be able to understand what's actually happening. So surveys are critical to us being able to understand whether women are getting the services that they want and that they need, and giving us inputs that we can use to help leverage other data, right, that we get potentially more often.
Thanks. So don't worry, you're on deck. So I'm about to come to you and
Well, I want to respond on the survey question as well, which is
hold on. I'm going to give you a bigger question to respond to on the survey to build on, which is, given all of this flux, this period we're in this in-between period, will FP 2030 produce a measurement report this next year? And how do we put together a measurement report that monitors progress when the DHS surveys are sort of looking back in time? What are you going to do as one of the main authors and constructors of this report to construct something that's capturing those surveys, but also trying to look forward and look at these impacts and what we're learning? What's your plan on that?
Yeah, I think this builds on what Emily said, which is surveys are important. The DHS was renewed for 3 years. We don't know what happens after 3 years. At the same time, PMA is very limited in its scope and geographies. We're seeing the mixed surveys from UNICEF leaving the family planning module out in some countries. So we are moving forward in a more limited survey environment. Even with the DHS, it will continue only in select geographies. So what can we do in the years to come, and specifically in the next year? We're looking to our partners. We're looking to Track 20 to review HMIS, LMIS data. We'll look at RHSC to share more on commodities. We're looking at different organizations who are still providing services like an MSI or an IPPF. That's what we're hoping to do to understand impacts, because Emily's right, we won't have the surveys to give us insights into women's use of contraception and need.
It's a sobering picture. I mean, there's the sobering financial picture ahead of us. I think Adam has laid that out. I think it's a sobering picture in terms of the possible impacts at a country level. I think Emily has laid that out. It's a sobering picture from a data availability perspective and what tools we'll have available to continue to monitor progress. I mean, I'd like to talk about monitor. We want to, if there is progress, we want to celebrate those successes. I know that countries will be resilient, and countries and private sector partners will find ways. But I am also looking for the canary in the coal mine. And I think it's great to have this group of data partners here. We will continue to activate this group, convene data partners. I also see many global and country partners who are working on this in the chat and participating. Samu said it's going to take all of us. It's going to take the partnership to overcome this. And obviously my commitment and our commitment as data partners is to work with you on the data side of that. People had asked how they can get involved in countries. Obviously, we have colleagues across FP2030, across many of our organizations who are working in these countries, looking at data systems, advocating for financing, folks at a country level, folks at a civil society level, and working directly with donors in those countries as well. So I think you have our commitment, and you're hearing about that commitment today and some of the creative ways that we'll be working on this. And one of our hopes is that after this webinar that's looking, I won't say globally, but across low and low middle income countries, that some of our regional hubs will be able to work with us to host regional specific webinars in which we could dive into particular regions, particular countries. And so stay tuned as we try to organize that. We will be convening data partners over the next several months to think about the report ahead and how we will organize ourselves and look for these impacts. And we'll certainly be creative with the types of data analysis. Our goal is also to aggregate other impact reports. So if you are working on an impact report and you want to get it out to the community, we do have this repository that was mentioned at the beginning. We don't want you to have to go searching everywhere, every website to find those. So we're trying to host those in one place, and we're committed to doing that as well. I see, Dr. Samu, that you are still with us, and I'd really just like to turn it back to you for any closing reflections about this commitment from FP2030. Thanks, Dr. Samu.
Thank you, Jason, for committing us to work even harder. That's what we always try to do in these circumstances. And thank you for the team, the panelists who have so eloquently described what is happening. I think one of the key issues, Jason, you highlighted this, is not just the loss of funding that we are seeing, it's the halo effect that happens because of this loss of funding. Some of the governments that are becoming bolder to actually exclude family planning, some of the agencies that feel that it's okay to actually remove the modules on family planning, as Shiza highlighted. So thank you so much for bringing this community together. Adam, you have highlighted these complexities, especially of US government funding flows across and how it would even remain complex. And we are going to be working with partners like PAI who are here in the room to understand how that funding is allocated and what is happening up the hill. Thank you so much again, Emily and John. I see you are here in the room from Avenir, highlighting the challenges of even the data. And Martin, I see on the comments that you are saying we need to protect some of these data sources that we have. Again, kudos to all those countries that are showing those signs of resilience. I think, as we say, the proof is in the pudding. From henceforth, we want to see, and we are hoping that these countries will still maintain this impact. Indonesia, Philippines, Bangladesh, where they have been, but also these signs of progress, seeing where Zimbabwe, Kyrgyz Republic is, and Cote d'Ivoire, where they are going around the spend per capita for family planning. Again, thank you for joining us in this webinar. Kudos to everyone who contributed, and let's continue working together in this partnership. Thank you, Jason and Althea and team. Take care. Althea, I don't know, this is the recording available, please. Over to you, Jason and Althea.
Thank you so much. So we will make this recording available through the FP2030 website and through social media channels. We do that quite quickly, so it should be available by the end of the day. And we really look forward to working with all of you. Thank you so much to my panelists, to Dr. Dubé And with that, I hope you have a wonderful day, evening, and week. Best to all. Thanks.